Hello, everyone. Thank you so much for joining us today. We are here to talk today in particular about mental health because May is Mental Health Awareness Month. With us is Dr. Marina Villani. Thank you so much for joining us. You're a clinical psychologist here at Nicholas Children's Hospital.
That's correct.
Such an important topic because it affects children, teenagers, and young adults way too much, mental health. And that's why we wanted to let all of you at home know if you have any questions or concerns when it comes to anxiety and depression. We're going to concentrate and focus on those two mental health conditions in particular today because they do affect children in our community so much. So if you have any questions or concerns, please send them to us, Doctor. We already received some earlier in the week that we'll be addressing. For now, we just want to mention, for those of you that wonder, and I doubt that you do, because most of us know that mental health is definitely affecting children, but to what extent? In 2021, a national emergency was actually declared by the American Academy of Pediatrics, American Academy of Child and Adolescent Psychiatry, as well as the Children's Hospital Association. And that is because so many children are being affected by mental health, in particular, as we mentioned, anxiety and depression. So let's get started off the top with anxiety. What are some of the signs that parents should look out for where it's not just your normal, if you will, level of anxiety?
Yeah, so I think it's really important to note that anxiety is a normal response to something that causes stress, right? When it becomes a clinical significant, or what we call an anxiety disorder, is when it impacts that child's quality of life, meaning the child starts to avoid certain situations, friends, they start becoming more irritable. For example, when separation anxiety occurs, the child becomes very distressed while separating from the parent. They might get nightmares. They might have severe tantrums when they're very, very small, because separation anxiety and anxiety in general can start presenting itself as young as 2 years old. We see children presenting with anxiety. So there's a difference between the normal anxiety, like, oh, we're doing this Facebook Live, right? So that causes a little bit of anxiety. And I always teach my kiddos, it's okay to have anxiety because it gives us a little bit of motivation. Yes. Yeah. But when it becomes a problem, like for example, if I can't be here because I start vomiting or I start crying hysterically or I get stuck and I can't even speak, then that's a clinical anxiety disorder.
And so for parents who are listening to these signs and saying, my child definitely has been projecting that or showing that, what should they do? At what point do they need to seek help?
So I think it's very important, as parents, we're the experts, right, in your own children. Anxiety can look very different, and depression, by the way, can look very different from child to child. But if you're the expert in your child and you see that your child's sleeping habits have changed, they sleep too much or too little, they start having differences in their appetite and where they're eating, they start isolating themselves. If you have a child that usually you see them engaging with friends and all of a sudden they're avoiding certain situations or events at school, then that has a problem. But the specific thing to look out for is when that child's normal day-to-day life is impacted in a way that it causes severe distress in the child.
And so for parents, let's say that they want to first address the conversation. How would you advise parents to approach and I'm sure it depends basically on the age of the child, right?
Absolutely. I think it's very different coming from a very young child, like think about 4 years old. I think the most important thing is to talk to children at home and foster a culture in your home where you can openly talk about certain subjects. It makes it easier. So if we start young, talking about different things, how do you feel? What happened in school today? And it's okay if your child, because I know parents get discouraged. That's what I hear all the time when your child is like doing the whole, I don't know, fine, I don't want to talk about it. Yes, avoidance. But I think it's very important for parents to not get discouraged and just keep asking those questions, model those things also to their children, like, okay, they don't want to speak, but you can say, oh, at work, I got super anxious today. I had this meeting back to back. I got really nervous and I started to cry, but then, I did a little meditation and I put like a silly song on. So you're not only modeling what to do, but you're modeling that it's okay to feel that way. So your child is more open to those conversations. But if you have no clue to what to do, because some parents freeze, right? Because they get anxious as well. So if parents or caregivers freeze, it's okay to ask your pediatrician. And sometimes talking to a professional can also help you have those conversations with your child if you don't think you have the tools.
And really, it's a great reminder, but the first line of defense is the pediatrician, correct?
Yes.
That's your first safe bet.
Yes, the pediatrician usually knows your children. They know you as a family, so they know how to talk to you guys more. They will have referrals for the community. So I think first line of defense definitely is a pediatrician.
When we talk about anxiety, at least in the experience that we've had, right, personal, I think if, let's say, your child has already been identified as definitely having anxiety, aren't there certain things, or what can parents do to kind of lessen the damage of it, if you will? For example, you mentioned sleeping patterns. Sleep is extremely important, is it not?
It is vital. If a child is not sleeping the correct amount of, what is required for their young age, in your sleep, in your REM cycle, is when all this learning, you always call it like your little village goes into your brain. That's how I explain it to kids. And they file things that are important, not important. They toss out what you don't need. So if that is interrupted, your body's not going to function the same way. You're not going to be able to pay attention. That's another thing that children struggle a lot with, because they feel, sometimes they get misdiagnosed and they're saying, oh, it's just hyperactivity or inattention. When you look, sometimes, yes, it could be ADHD and anxiety, but sometimes it's pure anxiety that's impacting that child's ability to pay attention. On top of that, you put no sleep, it's going to be even worse, the presentation.
And when you mention about diagnosis, how important is it really? Because they mimic each other, right? It's different conditions.
Yes, and depending on the child's personality as well, you can have a child that's very anxious, and it's a child that's jumping off the classroom, or they're fidget a lot and they start sweating. And so when parents go to the pediatrician, for example, they're like, oh, he's always hyperactive and fidgety, and they might assume it's ADHD. No, I think it's really important, the correct assessment. So first time your pediatrician, if you're a pediatrician, usually they have questionnaires in their office. It's really important that you're as honest as you can. I know sometimes those questionnaires can be invasive, and some parents are like, I don't want, my child to do this, or I don't want my pediatrician to know that my child is going through something. So be as honest as you can during those questionnaires, because we can only help if we know that something is wrong.
Yeah, as parents, we need often to drop the judgment of ourselves, right?
Yeah.
It's not about
everybody's
judgment.
going through something.
Yeah, it's about getting our kids the help they need and being as honest as possible, as you mentioned. When we talk about depression, sad that the numbers are really staggering when it comes, especially teenagers and depression.
I think the issue that we're seeing right now, we've always had children and adolescents with anxiety and depression, but I think the problem after the pandemic and during the pandemic is that we're seeing anxiety and depression, and so multiple disorders at the same time, at a very severe presentation. So depression is this extreme feeling of sadness and hopelessness. So if you have a child that is not only isolating, but is always having that negative self-talk, that is always pessimistic, talks about death a lot, expresses death wishes. Sometimes our children are very verbal, and they might express things like, I don't want to be alive anymore, or things are useless. So if that happens for more than 2 weeks to a month, it is considered a major depressive disorder. It impacts your sleep, it impacts your appetite. Sometimes kids eat a lot. Sometimes kids will eat less. Some kids will gain a lot of weight. Some kids will lose a lot of weight. So again, it's just depending on the child. But if you see your child in this hopeless circle, and nothing, they're not doing things that they previously enjoyed, like going out with friends or sports. Now all of a sudden they want to be alone in their rooms. Those are little red flags for depression.
With teenagers, I know that there's, when you say sleeping patterns, they're like on the other side. They want to sleep all day. But sometimes is there a way to differentiate where it's like the normal teenage sleeping in, or maybe depression?
Yes, because sometimes depression, I get parents that come in and they think that their child is lazy. But when you talk to the child, they're staying up all night. And so during the day, of course, if you're up all night doing fun things, then that for me is not being depressed. But if your child is up all night crying, unmotivated, doesn't want to eat or eats too much, friends are telling you, oh, he really doesn't want to hang out with us anymore, teachers start commenting, it's really important to tap into your village, right? It takes a village. Yes. So tap into the teachers. How is he doing at school? But if your child is not sleeping because he's having fun, I think it's a safe bet that they're okay. But if your child's not sleeping because they're ruminating on negative self-talk, then it's a problem.
Or like you mentioned, isolation, right?
Yes.
Isn't that just a key sign usually?
It is usually, because people that are depressed don't want to be around other people, because sometimes what kids call it nowadays masking, they have to put on a show and they have to be happy all the time, and that takes a lot of energy to be functional. And you can be very functional, don't get me wrong, while having depression. You have kids that have 4.0 GPAs, but then when you talk to them, they're tired all the time. They don't think that they're good enough. And then just vicious cycle of negative self-talk and that hopelessness. And imagine a teenager, such a young life, being so hopeless. You still have your whole life to live. So
how important is seeking professional help?
I think it's vital. I am from the school that let's prevent things from getting worse. I know there's different cultures that we have to respect. But it's really important to seek out professional help as soon as you feel, as a parent, as a grandfather, as a caretaker. If you see your gut is telling you that something is wrong and this is not my child, ask. You can, seek out the pediatrician, or you can also seek out a mental health provider.
Let's talk about the dreaded best thing ever happened to us, worst thing ever, social media.
Yes.
Oh, the internet. It's so tough on our kids.
I know.
What do you see when your patients come to your office? How much of a role does that play?
Social media is beautiful, right? We're doing this. It creates resources. So for me, social media, I never want to put it down completely, but an unsupervised, all access pass for a little human that doesn't have their frontal lobe developed, that is not conscious of right or wrong, or very naive, or just very influenced easily, then that becomes a problem. I can say right now with a lot of confidence, and we talk amongst ourselves, there's different social media platforms, I don't want to name anyone in particular, but that all my kids that have depression are on it.
So and there's a common theme?
It's a common theme, and I always ask, are you part of this social media platform? They're like, yes. And I'm like, let's try to limit that, because it's just unfiltered, and you don't know, and these kids don't know. You can be talking to an adult, you can be talking, and they have extreme access to everything. To topics.
Opening themselves up also to so much criticism.
Yes, and so it's not only at school. I always tell parents, when I was growing up, the bullying or the criticism stopped at school. My mom will pick me up, and then I'm the most beautiful human in the world. I can do no wrong. Sure. But then nowadays, kids don't have that, because they come home, they're on their phones, and they're being attacked 24/7. So imagine not being self-assured and being able to say, I don't care, because as a child, that's really hard. And being bombarded 24/7, that's going to have a negative impact in your overall self-esteem and how you want to project yourself. So it's a huge issue, but if used correctly, it can be really good.
Yeah, and that's what I was going to mention. Huge issue, as you said, and so it seems almost impossible to tackle, because honestly, how many of us are really going to succeed in keeping our children from social media, but maybe limiting the time?
That's what I recommend. Listen, if a parent straight up tells me, what is the correct age? I get that question a lot. What is the correct age for my child to be able to use social media? I can't say, because each family, I call them they're their own little culture. So what works for a family might not work for another family. Sure. But the general rule of thumb is maybe in their teens, so 13 and up. I wouldn't, recommend an elementary school child to have social media. Maybe they can use it through their parents' phone and account, so the parents can monitor it. But if you have a child, you know your child. If you have a child that is very naive, that is eager to please everybody, maybe that might not be the correct idea. Or if you engage and you're fine, I'm tired, fine, you get it, monitor it. Try not to have them have the phone at night 24/7. Okay, the phones are out by 9. At night when everybody goes to sleep, the internet, there's different parent applications that they can shut it down at night, so they know that during the night, if they're not sleeping, it's not because they're in social media.
Yeah, and a lot of parents, I hear them say, at least at a certain age, I'll allow my child to have it, but they have to be my friend. They have to friend me.
But be careful, because I've learned that children will have that account for the parents, but then they have 5 different accounts. So it's their fake Insta and things like that. So when parents tell me this and they're very proud, I feel bad breaking the bubble, but I'm like, your child has 3 or 4 different accounts.
Just so you know.
Just so you know, yeah.
Keeping it real. When it comes to treatment for anxiety,
yes,
there are many different avenues.
Yeah, there's different school of thoughts, right? Medicine and all our professions, there's always one way or another, but the most researched evidence-based model that we have is something called cognitive behavioral therapy. And basically we want to teach children that the way we think shapes how we feel and we act sometimes. So I always tell my kids, emotions don't ask permission to be felt, right? They're not hey, Betty, do we want to feel sad today? Are we feeling depressed? If it would be like that, it would be beautiful. But it doesn't work that way. But what we can control is that automatic thought that pops up because I feel sad. Maybe we can turn it into more helpful thought. And so we teach children to put more helpful thoughts in play so they can influence and, better manage their behavior. Because if I feel sad and I feel hopeless and everything is a catastrophe, then we're not going to act accordingly, right? But if we try to say, what would be a more helpful thought? You're scared of going to prom. Okay, it's okay to feel scared. We need to validate kids' emotions. I think sometimes as parents and caregivers, we're so hesitant to validate because we want to protect our children. No. And I'm Hispanic and Latin, right? So we're like, no, you're fine. Why are you sad? You have nothing to be sad about. Yes. That is so, detrimental for a child because they feel like they cannot express how they feel. So first validate, and then try to help them problem solve, like solutions or different thoughts that could be more helpful for their day-to-day life.
For parents watching who perhaps aren't as familiar with validation, give me an example of validate so they get it.
So for example, if your child comes to you and says, Mom, I feel like very down. I don't know why I feel sad. Instead of saying, why do you feel down? Why do you have to feel sad?
About?
You have a roof over your head. You have food. There's children dying in places in the country. Instead of going into that place, which comes from a place of love, right? We want to give children perspective. I think it's what it's called. But you might say, it's okay to feel sad sometimes. The other day I was feeling sad too. But you know what I do when I get sad? I watch a silly song or video. I cook something yummy. I go for a walk. So you don't only tell them it's okay, but you model what's okay to do, like coping skills, which are so important.
And just validating, right? That is so powerful. Just the saying, I hear you, right?
Yeah, without judgment.
I'm so sorry you're sad, or I hear how sad you are.
Yes. And without judgment. I feel like the judgment part is what prevents children and teenagers from coming forward and expressing how they feel to parents because they feel judged. Like if parents, we will never feel sad in our lives. Like adults have felt what you felt at some point. But sometimes we lose perspective and we forget how tough it is in those young ages to feel that way.
Yep.
Yeah.
So now we want to get to the questions. We have so many great questions from followers who have been sending them throughout the week. And if we repeat ourselves, if this is something that the doctor has already touched upon, I always like to say repetition is the mother of learning. So we'll learn it even better.
I like that quote.
First up, how can we help our kids and patients in light of limited access to mental health providers?
Well, this is a great question. I feel like it's really sad to hear because I work in the mental health world. And it's true, we have a deficit. We don't have enough providers. Right now in our hospital, we have a wait list of I don't know how many children, and that is really sad. But I think the first thing you can do, if you call your insurance and you can find within network providers, so your insurance might have a list of people that take your insurance, you can start off by calling, and it takes time. But don't give up. Start calling because someone might have a late cancellation or they might have a new opening or a new scheduling. You can also look for your resources, free resources. I know like social media and YouTube, we have like if your child is anxious and can't sleep, guided meditation for children sleep. And there's a ton of free content that is good. And I always tell parents, if you're hesitant, listen to it yourself first. And if you agree that it's really relaxing and doesn't go against any of your value system or anything like that, then use it. And then your pediatrician's office sometimes have different like pamphlets on like what to do for anxiety. So yeah, we do have a deficit of providers, but it's not impossible. Right now we have other apps that are virtual care and sessions that you can also tap into. So there are resources out there. We just have to tap into them.
And as a parent, my experience has also been advocate for your child, right?
Yes.
And like you said, it's not easy.
No.
You may be on that phone for the longest time on
Yes.
hold. I know it's easier said than done, but don't give up.
And you mentioned something so important that prompted me to think, the advocating for your children. In schools, it's really important. You can go to your school and ask them to teach your children since very young age. I want my child to really learn about mindfulness. Is there a way that we can create a workshop in the school? And you talk to a few parents, all you need is like one or two, and maybe after school they can have a professional come and give a chat about mindfulness or coping skills or self-esteem workshop for parents. Like, advocate. If there's not something in your community, we can also create it.
And how wonderful.
Yeah.
And for you to participate with them as well.
Of course.
You mentioned that you could lead by example as well. So you could do a yoga class together or meditation.
Go for a walk together, watch a funny movie, cook something.
Wonderful. Another question. What are some coping methods for a child who's suffering from anxiety?
So there's different coping methods. I'm going to tell you my favorite and things that I work with kids in the hospital all the time. It's called the 5 sensory stimulation technique. And basically when you're anxious, right? I don't know if you've ever felt very anxious.
Absolutely.
But sometimes words are hard to get in when you're anxious. In Spanish we say, cálmate.
Calm down.
Oh no. That's horrible. And the child will, as an adult, you get more irritable. You're like, this is useless. So sometimes we have to go back to your physiological response. So basically what I teach children is, anxiety is your amygdala, which is a structure in your brain that goes haywire because something is wrong. but I call her a she, doesn't have eyes or ears to listen to or see what's happening. So basically it's freaking out. So what we need to teach is our amygdala to calm down. There's not a huge bear chasing us. There's nothing wrong. It's okay. So if we stimulate our 5 senses at the same time for at least 5 minutes with a pleasurable thing. So I make them do like sensory kits. So tasting like maybe a candy that they like, listening to a song that they like while petting one of those like sensory balls or like a furry thing. So you stimulate those 5 senses. Your amygdala cannot be concentrating on like, oh my gosh, I might die, while having your sensory experiences being
pleasant.
Stimulated. Yes, exactly.
That's incredible.
So 5.
That's excellent. Mm-hmm. I'll be using that myself. That's excellent. Do you have any advice on how parents can help a child who's dealing with anxiety when it comes to testing? That puts so much stress on kids.
I know the FSAs just passed, which is our standardized testing here in Florida. Mm-hmm. So basically we want to acknowledge if your child has any learning disabilities, because I get this a lot. Sometimes the most anxious child is maybe a child that has been passing through school with a learning disorder.
That hasn't been diagnosed.
So that's why when we were talking about early assessment, early intervention, we want to set up our children to thrive in this world.
Of course.
We don't never want to assume that nothing is wrong, or we don't want to assume that everything is wrong at the same time, but we want to make sure that we put things in place for them to be okay. So if we're ruled out that everything's okay, there's no learning disability or anything like that, it's just pure anticipatory anxiety, which is what we call it. There are things like study techniques that sometimes schools have workshops to teach your children how to take standardized testing, for example. We can teach our children how to do mindfulness exercise. And mindfulness is just like a fancy word for being present in the moment. Because what it is, what I tell kids is, you're thinking that you're already going to fail without even seeing the test. So if we can ground ourselves with a breath, just takes a breath.
Oh, breathing is so important.
You just take a breather, and there's a bunch of YouTube videos that teach children in a very, appropriate way how to take deep breaths. So being present in the moment, being mindful, talking to your teacher if it's like a continuous problem. Maybe they need extra time. Maybe they need to be placed in an area in the classroom that has less distractions. And always having that communication open with the teacher so we don't miss anything.
I'm going to put you on the spot now, but we are here to educate. Would you show me like an exercise? I know that I just learned one recently, breathing, a simple one that can help right away to calm you down.
Of course. So let me get my pose on. So one of the easiest ways is to imagine that you have a little balloon inside your stomach. So I have kids put one hand in their stomach, whichever they want, and one in their chest. So we do this backwards. When we take a breath, what do we do? And we tuck in, right? Yeah. So it's the opposite way. When we take a deep breath in, we want to expand that little balloon inside our stomach. So it looks kind of weird, but it works. So, and when you exhale, you want to make that exhale longer than your inhale, and then you want to deflate that balloon. So naturally, your tummy will go in. So you want to try that?
Yes.
Okay.
Okay. So breathe in.
So in and out. Doesn't that feel better?
Absolutely, and it's completely
it's so
opposite
simple
from what we normally do.
But babies do this all the time. If you watch a baby breathing, they breathe this way.
Oh, they're so
but
smart,
sometimes we lose it along the way. Yeah.
Yeah, that's great. So thank you for that. That's what I had heard, that the exhale, if you keep it longer, just that better. Already, I didn't know that. Yes. So thank you so much.
Of course.
Social media has a huge impact on kids today. Mm-hmm. Do you recommend keeping them off social media until a certain age? We mentioned that earlier.
Yes, I recommend until they're teenagers, so 13 and up. That's my recommendation. Of course, we see now more and more demand for earlier. So if you're going to have your child on social media earlier, make sure that you have access to that account, that you're monitoring it, that you're putting pauses, that you're saying, okay, after 7 or during the dinner table, there's no phones, and things that you have to put limits, because sometimes when we get free access to something, it's going to be really hard when you have to take it away.
Yeah, and too much of anything
is a bad thing. For you. Yeah.
How do you tell your kids that you don't think someone is a good friend to them without pushing them even more towards that person?
Yes. So one thing I teach parents is how to do like open questions to like help navigate your child to get to that conclusion themselves. So for example, what do you think a good friend is? Just open. Don't insert, that person's person. Yeah. And this could be in a car ride to the school or something like that, and that person can just say, I don't know. I think a good friend might be someone that, has my best, intentions and wants the best
at heart.
Yeah, exactly. Someone that if I'm sad notices and comes up to me. Do you have any friends like that? someone that if they don't know the answer, they will go to the parents or ask your mom for help. So you have open-ended questions, and then if they are like, I don't know, then you can insert certain things without and allow them. Trust your child, like trust the teachings that you have on your child to do the right decision. Sometimes we get it wrong. Sometimes as adults we get it wrong. So it's okay for your child to get it wrong.
Absolutely.
Because but you have to let them know that you're going to be there just in case.
No matter what.
No matter what.
Great advice. What does depression look like in younger children? Are there any techniques or tools that children can use to decrease their anxiety when they're in school?
Okay, so the first part of that question is the depression in younger children usually looks very different from a depressed individual that is an adult. So depressed children usually are very irritable. They will bang their heads. Sometimes they will go to self-injurious behaviors, very tantrum-like and very irritable. Again, the sleep, the appetite, all those things are red flags. But when we add to that hopelessness and severe irritability, then it's depression in children. And then the second part of that question, what was it? How to help?
The second part is when they're in school. Is there any techniques we could teach our kids so that
Yes.
they get stressed out at school?
So some schools have, you can have a Plan 504, which is something in Florida. I don't know if in other states it's different, but basically what it means is a written document that your pediatrician or your mental health provider can sign saying, you know, my child suffers from clinical anxiety. The provider has recommended for them to be able to maybe during a test or before a test take 5 minutes off, you know, walk outside or do a mindfulness technique. So they're going to have a fidget toy, so don't take it away. So there's different things that we can put in place for your children at school, but it needs to be in written form so they'll protect it.
So this is something if they feel they need it, talk to their pediatrician or their healthcare provider.
For a Plan 504 here in Florida. In other states, it might look a little bit different.
Okay,
Yeah.
great. And then the next question, at what age do we as parents learn to trust and respect our child's privacy? Is there a difference in dealing with privacy with younger children versus older children? For example, a young child having a diary and not wanting to share that certain information. Should we go in there and...
No. So again, there's different cultures, different value systems. So I don't want to say something that would make someone feel bad. If you did, it's okay. We're all human. But trust is a two-way street, right? So if you create and foster a culture in your own family since very early on of we talk about feelings, we talk about our emotions, we might not find ourselves in that position to be snooping around because we talk about, you know, we might not talk about everything, but we know that our child is open to communicating with us. Because once that trust is broken, either way, if a parent breaks it or a child breaks it, it's really hard to gain it back. So let's try not to break it in the first place. So prevention is key, right? Let's foster a healthy environment in the home. Let's foster, I don't know how many families, my prescription, like the aha moment is like have dinner as a family once a week. Because people are not doing that.
That's become an aha moment, but...
Because people don't do that anymore. Because everybody works, everybody's tired, so you eat dinner like once in the room. But like try like fostering those conversations at home and maybe you won't have to go through someone's diary.
Don't sneak in through the diary. And if you do suspect that your child perhaps is hiding something, has a secret or something, what's the best way to approach that without alienating them, as you mentioned?
So you might go straight to the source and ask an open-ended question. So is everything okay? Everything's fine. What are you talking about? I've just been noticing that you've been irritable and more isolated. I hope that you know that if you need anything, I'm here. If a week goes by and you're still having that resistance and that irritability, take them to your pediatrician. They might, you know, they might ask a questionnaire, they might screen them, and then they might suggest to, you know, to go see a professional.
And I don't know if I'm wrong in saying this, but sometimes, isn't it that kids will open up more to strangers than to their own parents?
Because there's no judgment. Listen, children want to protect their parents as much as parents want to protect their children. And I think people lose that a lot. I don't know how many kids will hesitate, not because they're not a great parent. They're like, I love my mom so much. I don't want to make her feel like she's doing something wrong. So when I hear that, it just breaks my heart because everybody's protecting everybody, but everybody's walking on eggshells.
Yeah, and therefore they're getting nowhere.
They're getting nowhere. So sometimes talking to a complete stranger that out of the get-go says, I'm not going to judge. You have confidentiality here unless you tell me you want to hurt yourself or somebody has hurt you. It takes a burden off of the child of having to protect that loved one and being able to process all those things in a safe environment.
And important to mention, as we said, that the statistics are staggering. If a parent who's joining us now fears that their child is in danger of hurting themselves,
you take them straight to the ER, your nearest emergency room. It doesn't have to be a children's hospital. And when you're in the ER, they will do an assessment and they will help you through it.
Better to be safe than sorry.
Yes, because I sometimes have parents say, oh, I think it's for attention. It might be, but guess what? Teenagers are notorious for having a low impulse control. So if they do something for attention, but they go through it, those are accidental, suicides. So better safe than sorry. And even if your child is gaining the attention, we want to go to the bottom of as to why. So seeking that help and being able to process why we're engaging in these risky behaviors, for example, is very important as well.
At the end of the day, we want them alive,
yes,
healthy and happy, right?
Yeah, and not happy all the time. I tell kids
that's true too.
We're not, we're not rainbow color pink everywhere, but we want to have happy pockets during our day. That's what I call it, happy pockets. You might have a bad day, but if you laugh once, that is a happy pocket. And if it lasts 1 second, it's 1 second that you didn't have.
Cherish that moment.
Yeah.
Thank you so much, doctor. Any questions come in? Okay, so we covered a lot.
That's good.
I want to thank you so much for joining us.
Thank you.
Again, mental health, we could talk about it for days and months. And I guess that's what's important, is that we are talking about it, that we keep the communication open. So thank you so much for joining us, and we hope to see you again next time. Take care.
Bye.
Thank you, Doc.